Okay. Hello, everybody that's just joined. It's great to have you all here. I think we're going to get started now. We've got a tricky topic ahead of us, and we've got plenty to talk about. If you find yourself with sort of questions throughout the webinar, do feel free to submit them, and we'll be having a Q&A at the end, so we can engage with them then. So, this is a really difficult topic, and there's lots of different issues to consider. So we're really grateful to be joined by a mix of panelists with really diverse skill sets. Maybe after I've said your name, you could just say a few words about the unique perspective that you're going to be bringing into this discussion. So we've got Dr. Kelly Thresher from the North Hampshire Urgent Care, who's a GP clinical lead.
Yeah, hi everyone. So I'm Kelly. I'm an urgent care GP and clinical lead. So my perspective today is going to be really practical. I'm seeing where AI is actually being used on the ground rather than where we think it might go. I work mainly in urgent and unscheduled care, but I've also got portfolio roles in appraising, mentoring and supporting doctors, which means I get a view not just from the front line, but across a wide range of clinicians. So overall, I'm seeing how AI is already quietly embedding itself into everyday clinical work.
Brilliant. Now, that's going to be super valuable, actually. Yeah, a really wide perspective. And we also have Marcus, who is also at North Hampshire Urgent Care, who's wielding dual titles of Change and Improvement Lead, whilst also being an Information Governance Lead. Hi, Marcus, great to have you.
Thank you, Joby, and hello, everyone. I'm Marcus, Change and Improvement Lead and the Information Governance Lead at North Hampshire Urgent Care. My background's in helping organisations make sense of change, not just technical, but cultural and behavioural as well. And that's what determines whether something succeeds. At NHUC, that means working closely with our teams, understanding how we work today, where the friction points are, and what we can introduce in the way of new ways of working to make sure it's safe, proportionate, and aligned with our appetite risk. I suppose a big part of my experience has been supporting digital and operational improvement across NHUC, from governance and data protection through to service redesign and staff-facing tools. So the perspective I bring is very much about balancing innovation with responsibility, making sure we can stay ambitious, but also thoughtful, safe, and grounded in good judgment as we adopt new ways of working.
Brilliant. Yeah, really great to have that governance expertise on board. And also Dr. Mike Nix, who's a clinical scientist, AI researcher. I know you've got lots of experience in education, and you're currently at the Leeds Teaching Hospital Trust. Great to have you here, Mike.
Thanks, Joby. Yeah, I'm Mike. I wear various hats. I work partly in the university, developing novel AI technologies for healthcare. But in the hospital, I'm a transformation and implementation lead for AI within medical physics, which covers radiotherapy and also radiology and various other parts of imaging-based science within the trust. I've also worked extensively with NHS England, looking at education and policy around bringing AI and other digital tech into healthcare, particularly with a view to confidence in the AI technologies that we use and how we can integrate them into workflows for maximum efficacy and actually get the benefit out of these technologies without too much of the risk. I'm also a member of the AI Governance Board at Leeds Teaching Hospitals.
Brilliant. Thank you, Mike. Yeah, I think knowing what people are going to be needing to use these tools effectively and that experience is going to be really valuable. So finally, my name is Joby Shepherd. I'm a digital learning designer at Skills for Health, and I'm also an AI specialist with the company as well. So to kick things off, I think it'd be great to get a temperature check from the room. So it's really clear that actually GenAI adoption is very fragmented across different organizations within the country. So it'd be great to hear from you. We're going to put a Teams poll out there. And I'd just love you for people to contribute. How far is your organization currently on its journey with GenAI adoption? Be really interested to see what the mix of positions are in the room, whether we've got sort of AI specialists joining or people that are interested in finding out. Okay, so we seem pretty close to the middle. So we're 2.3 out of 5. So it looks like we're right in the middle of a variety of people more mature in their development and lots of people that are new to it as well. So I think one thing that's become really clear from the articles, surveys, studies that have been published so far is that there's actually a real tension when it comes to this question of adopting GenAI. So on the one hand, the benefits are very much real. Tools are getting better every day. And so there are really persuasive reasons for people to want to be adopting these tools now. But also on the flip side of things, perhaps one of the biggest law that's going to be governing the use of GenAI in healthcare is actually one that was released in 2002 called the Medical Devices Regulation. And there's a real lack of precedent for what the legal and liability picture here is. So I think that people are also quite rightly cautious, and there's an equal number of people feeling that actually they want to wait until things are clearer before they begin. So there's genuine pressure on both sides. And speaking about the excitement to, begin using these tools quickly, it's not just the case of internet hype, even though there's plenty of that around as well. To pick just a few examples of things that we've seen, there's been large-scale studies finding, quote, unprecedented time savings for admin support tasks. There's the fact that ambient scribes are actually letting clinicians spend more of their attention on patients and less on note-taking. Of course, less paperwork is always a good thing. The promise of AI to help with decision-making. And then perhaps the most boldly of all, actually, is the government's own 10-year health plan, where they're promising that the NHS is going to become, quote, the most AI-enabled health system in the world. And they're actually having a vision where every single nurse and doctor is using these tools to help them make decisions. So on the flip side of things, though, I think there's a very genuine feeling of skepticism and caution, which is very much warranted as well. In a really fascinating study that was done just December last year on how GPs are using AI, it's just become very clear that actually people in healthcare can't be expected to be AI experts right off the bat. But equally, there isn't very much in the way of concrete training that's been out so far. Understandably, there's been really firm messages that these tools need to go through the proper approval routes. But unfortunately, again, we've got a quote from that study, for some people even trying to go through those proper approval routes, it's actually so complex that they've not been able to get anywhere with that. And just as one way of illustrating that, this is a screenshot from one of the key regulations I mentioned earlier, the Medical Devices Regulation. And you don't need to worry if you don't need to be, reading or understanding this right now. But just these flowcharts, just to sort of illustrate the point. If this isn't already your expertise, then these proper processes can actually be intimidatingly complex. It's not the kind of thing you can just easily fit into your already busy days. So coming back to this dilemma then, there's very much real pressure on both sides of it. And of course, this isn't the whole picture. There is more nuance there, but we've only got an hour to talk about things today. And I would say that this is a very real tension that's at the heart of this issue in healthcare today. So I think it'd be great here to hand over to our panel a little bit. We can have a longer sort of free-form discussion towards the end, but I'd be interested to get some quick thoughts on how people have been navigating this. Marcus, maybe we could start with you. I mean, what have you experienced both clinically and in people when you've been trying to upskill them? What's your experience of this dilemma been like from the inside?
Well, my experience, and I think the biggest challenge that NHUC's faced has been the underlying pressure to move quickly. You don't want to fall behind when something like this in its early iteration is already evolving so quickly. But at the same time, there's a reality that national guidance and regulation, they're still catching up. The thing that we really did first and foremost was developed a policy and made sure that we had the right governance in place for early adoption. This has actually been really useful for defining what's in scope and outside of scope, and it actually sets the standards, what we'd expect from our staff. And I think that in itself has been invaluable because it's led to consistency in our approach, confidence in asking the right questions and vetting, and sharing an understanding across all staff. So I suppose where I will be coming from as a panelist is that you may not necessarily need to wait for regulatory certainty. There's no harm in actually building in good practice and good foundations early on. Setting up your policies, processes, it builds into cultural norms that don't actually lock you in. It prepares you for what's coming next and what might change. So safe adoption doesn't necessarily conflict with future compliance. I think it actually enables it.
Awesome. That's really interesting to hear, and really helpful, I think, to hear that practical side of things from someone that's been there and actually has experience of doing so. So concretely then, in terms of this dilemma on both sides, I'd like to dig in a little bit to the reality of what's involved with each of these options. You know, beginning to adopt now, as Marcus was talking about, and the counterpoint to that, you know, perhaps some people feeling like it's important that they wait. First of all, in terms of adopting GenAI now, one thing that's required is actually making quite a tricky choice, and that's what kind of tool you want to be using. There's bespoke tools out there, there's consumer GenAI, and it's important to know that these two kinds of tools aren't incompatible. So it's not one or the other, but it might be a question of which your organization starts with. We've got bespoke healthcare tools that can be ambient scribes, for triaging patients, for automating, discharge summaries, as well as the consumer GenAI tools that everybody's heard about. So there's Copilot, there's Claude, very easy to find on the internet. I think I'd love to turn to you at this point, Kelly, and just ask, so of course, as a clinical lead, as you mentioned at the start, lots of practical experience, and I'm sure you've experienced a mix both of uses that you approve of and that you don't.
Yeah.
What's the kinds of things that you've seen and heard? What tools do you experience people using, and what kinds of things are those tools being used for?
Yeah, sure, Joby. So from my experience, it can look quite different actually within NHUC compared to what clinicians are doing more widely. So within NHUC, we are lucky we've got Marcus, so the use is more structured and governed. We're about to use Tortoise for ambient listening to support our consultation, documentation, and hopefully speed up our doctors. We're also using tools like Copilot for administrative tasks, of course, with the caveat that we're not putting any patient identifiable or organisationally sensitive data in there. For me personally, I tend to use GenAI, so Copilot, more as a thinking and writing support tool. So things like improving my grammar, helping to work on CQC quality statements recently, and working out what good evidence might look like, summarising a long document like the 10-year plan, which was a long one, and acting as a thinking partner when I'm working through more complex pieces of work. Outside of NHUC, though, this is where I'm really interested. What I'm hearing from clinicians is a much broader and more informal use. And I think that I'm aware of that, partly because I'm not in a formal leadership role in those conversations. So people tend to be more candid about how they're using it. Some of its use is within their organisational guidance, and some of it is definitely more self-directed. So people are using Heidi and AccuRx Scribe for documenting their consultations, generating referral letters. They're using digital tools now like Rapid Health to really redesign how they're managing their patient demand. People are using AI to record and summarise meetings, for example, the Teams transcription tool. But I am aware of clinicians using Copilot or even buying their own GenAI. So as you've mentioned, Claude, ChatGPT, and it's been used in a variety of ways. So some, seem really like a great idea, pulling together guidelines, for instance. So asking Perplexity, can you give me all the guidelines, the relevant guidelines on managing heart failure, and then getting a structured summary with the resources. I think that's a really wonderful way of using it. But that clinicians are also using it to design patient text templates, writing reflective entries for their appraisals. You can spot that one a mile off. Building audit templates, and also drafting quality improvement work. Some, though, are using it more directly in their clinical thinking, such as working through case scenarios. So putting in anonymized patient case details, maybe putting their blood test results in there to help structure their decision making. Some are also using it as a supervisory or reflective tool. So, if they've had a really tricky case or consultation, maybe they're using ChatGPT as a therapy tool. And I think what I'm hearing certainly correlates with the findings from that recent Nuffield Trust research, looking at how GPs are using AI in practice. The other curious thing is that as a GP, patients are starting to use AI themselves to understand their conditions, prepare for their appointment, reading their test results. So you can imagine that actually in the consultation now, you've got 2 AI-informed perspectives in the room, which blows my mind. And it's quite a new dynamic, which we're just starting to think about. We're busy. Clinicians are busy. I mean, we're all busy. We're also curious, and we are always looking for a way to reduce cognitive load so we can get that cup of tea. GenAI does appear to help with that, which I think is what's making it so attractive. Although obviously we're still learning what that means. So for me, there's something really important around openness. AI use, this GenAI use, a lot of it's sitting in the background. People might not always feel comfortable sharing how they're using it. So for me, it's really ensuring that there's an environment where people can be honest about how they're using it, so we can raise awareness on how to use it safely. Also, the concerns around safety, around over-reliance, the fact that ChatGPT is not a doctor, it doesn't hold clinical accountability. It can't hold the nuance, it can't hold that, that maybe decade-long story that doctor's held with that patient and their family. And a lot of that is being held, happening outside of formal governance structures. So in summary, I don't think it's whether or not clinicians should use GenAI. I think they already are using GenAI. But for me, it's about how we support safe, transparent and well-governed use going forwards.
No, that's really interesting to hear, Kelly. That's such a variety of things. And as you say, people in healthcare are smart people and they're intelligent people. So they're going to be finding solutions to their problem. It sounds like there's a real variety of those solutions. Some of them approved, some of them not. So then, once a tool has been chosen, it's going to be really clear just from that, portrait that Kelly's painted of the story on the ground, that there's a real importance for both having compliance in the tools that are being used, as well as competence in the people that are using them. So this is where it's going to be fantastic to get Marcus's input. So of course, Marcus, you've got experience at NHUC taking GenAI from something useful that people are maybe using ad hoc to something that's actually compliant. And I'm sure the compliance side is something that lots of people are going to be quite overwhelmed with, especially given how fast these tools are changing and how young the regulation is. So just what would you say, I suppose, if there's people attending that are interested in adopting GenAI at their organization, but they're actually very new to it? What would you say that are the key steps in terms of compliance for those people?
Thank you, Joby. And you're right. I could probably take up the rest of this webinar if given the time. It's a very complex area. So I will do my best to keep this high level and brief, and I will avoid using any jargon, so layman terms only. For organisations that are new or curious about AI, first and foremost, I would say just keep things simple, but keep things structured. Build on what you have in place. Just avoid creating any complex framework on day one. It doesn't need to be complex. What you want is foundations, first and foremost. So if I was going to say in steps, step one, be clear on your purpose. What is it that you're looking to introduce, or what are you looking to solve? Where is the AI genuinely going to add value? Think to yourself, what are you actually trying to achieve by bringing it into the process? Once you've established that, step 2 is understanding the data flow. Now, this is very much coming from my informational governance perspective. Map the data that's going to be accessed by the proposed AI, and where is that data going to flow to? Ask, does it ever leave your environment? Does it remain within the UK? Does it transfer over to EU? Or are there actually international data transfer considerations to be had? Because each of those will have a regulatory impact. Even a really light touch flow map will actually give a surprising amount of clarity and prevent any unknowns and hidden surprises. Step 3, set your boundaries, and do this as early as you can as well. Define what staff can and cannot input into these devices. Kelly very nicely explained that we've got great governance at NHUC. What we're really keen on is making sure that what goes in is ethical and it's safe. Double check what tools that you're going to approve and what does safe actually look like. That's normally informed by policy, and having at least an interim policy is better than having none at all. As we know, humans are very curious creatures. And we know that use is already happening. So just having something in place to protect both them and the organization is absolutely key. Step 4, I would say build a proportionate risk assessment. Now, this does not need to be complicated, just a simple check of purpose, data, risks, and mitigation. Those are going to be your 4 pillars. A lot of people get stuck at this stage, so just repeat, keep it proportionate, keep it simple. This is about building in consistency to your review. It's not about adding unnecessary bureaucracy. So don't get yourself tangled. Step 5, training. Make sure you're educating your staff. It's important to recognize that the majority of risks, and it's interesting, but the risk itself is not from the AI technology itself. It's actually born from human error, either whether it's misuse or misunderstanding or overconfidence. Those are the usual culprits. So making sure to give staff clear practical guidance will reduce risks more than any technical control. That's what we have found. And finally, my last bit of advice would be make sure each of the steps mentioned are iterative. Start small, learn quickly, refine as regulations evolve. Compliance with using tools of an AI nature is never going to be a one-off exercise. It's going to be cyclical, and it's going to involve learning, adjusting, and improving. And your organizations that embrace that mindset, they're going to be the ones that adopt AI more confidently and successfully.
That's really helpful to hear. Thanks, Marcus. I think for a lot of people, that's going to be a little bit of gold dust in the sense that they might know all these processes are out there and important, but having not done them themselves, I think that's going to be great for people to hear. And as you touched on there, of course, the flip side of compliance is having competence and people that can use these tools effectively. So I'd like to turn to Mike here, because so we've seen worrying quotes earlier, both from that field health study, and Kelly was mentioning some use cases that people are in cases using these tools in irresponsible ways in some cases. I'd be really interested to hear from you, Mike, in your experience in helping people to be effective users of these tools in educating people, what are the most common challenges that you come across when trying to build basic GenAI skills in people? What are people missing,
Okay, thanks, Joby. It's fascinating. The conversation so far is fascinating. And I agree with both Kelly and Marcus in many, many ways. What's most interesting to me, I think, is the regulatory side, because we say that the regulation is from 2002 and it's out of date, and it doesn't support these sort of new technologies. But I think in one sense it does, and I think that's the sense in which Marcus and Kelly both touched upon of intended use. And intended use has been the mainstay of medical device regulation since I was born, I think, and it's a really helpful pointer, because it allows us to say, does this have a clinical purpose? Are we using it for clinical decision making? Are we putting clinical data or other special category protected data into it? And I think, broadly speaking, and don't take this as advice, if the answer to both of those is no, then you're using it for an administrative type task. And I think we should be encouraged to have the freedom to use GenAI in that way, in the same way that we use Microsoft programs or whatever we've been using for decades. So I think that's one part of the education process, is actually to make it clear to people, what are you doing? What problem are you trying to solve, as Marcus says? And in what way are you using this technology? And does it come under the information governance regulations around healthcare, or does it come around the clinical support, decision-making support, and therefore act as a medical device? The other thing that I think I would just throw in there, though, is that EHRs, electronic health records, have historically not been regulated as medical devices. And that's because they were always seen to just be a storage retrieval tool, effectively just a database where you put stuff and then you pull it back again without it changing. I think with the integration of GenAI into EHRs, or the ability of GenAI to impact data that flows into EHRs, we're now in a different place. And this is where I think the regulation hasn't caught up. And this is where I think there's the possibility for GenAI to impact the medical record, which will then impact on clinical decision-making by proxy. So I think that's an area to just be a little cautious of, and an area in which I think regulatory requirements may well change in the near future. But to come back to your question, Joby, what challenges have we found in terms of educating the workforce around the use of GenAI? This was actually a question I was asked 5 or 6 years ago in the context of not GenAI, other types of AI. And my answer was actually confidence rather than competence. And I said that the 3 most important things in terms of implementing AI in healthcare were confidence, confidence, and confidence. And I think that still applies. I think we need confidence in the tools that we're using. How were they developed? What was their intended purpose? How have they been validated? What have they been approved for in a healthcare context? We also need to have confidence in our skills at using GenAI, or any type of AI, or any type of technology for that matter. We need to know what its limits are. We need to know what its scope of use is. We need to know what its failure modes are. We need to have ways that we can be trained to find the failures that these systems produce in such a way that we can augment them without putting in so much effort checking their outputs that we erode all of the benefit of having used them in the first place, financially or in terms of time. And I think that then brings us on to the final one, which is kind of my bugbear, really, which is AI-enabled workflows. And that sounds very snazzy, but actually what it is a workflow which is built around the fact that you need to do this due diligence process. You need to be able to work out what the confidence you have is in the information that you're given. As Kelly was saying, the AI-informed clinical decision-making conversation, where both the patient and the clinician have a different AI, and perhaps they disagree with each other, and perhaps one's been given all the information and the other one's been given part of the information, or vice versa. Building workflows which enable the participants in the shared decision-making process to make genuine judgments on the quality of the AI advice that's being presented and is part of the conversation is really important. And particularly when we get further into sort of more automated types of clinical decision making, we need to make sure that the workflows have ways back. We need to make sure that people have a way to seek a human opinion, to question a decision that's been made if it's been made using AI. Yes. And we need to make that manageable for the healthcare system, so it's not overwhelmed by people just demanding that they want a human to do everything. So those are the challenges, I think.
That's really helpful to hear, Mike. Thank you. And yeah, totally on that point that actually, if you don't have time, I was working on some e-learning recently about GenAI skills, and we had this line that, if you don't have time to be taking these safety steps whilst you're using it, then you actually don't have time to be using it at all. But that's an essential part of use. And this relates to a little bit of a theme that's been coming up in what Kelly's been sharing as well, that actually a huge proportion of people are already using consumer tools, the ChatGPTs and the co-pilots at healthcare tasks, but almost nobody has actually received formal training on them. And this has been dubbed, the quote unquote shadow use of AI. And there's a real risk. So just one example from this study into its use in GP services Someone's really just saying, okay, I've been putting my blood results into it and it's great, I can get a second opinion. And this is a really risky use case, especially if it's in an unmanaged way without the proper risk assessments and governance processes. And so this is why having some sort of training and some adoption plan is so important. It's not because those things need to be perfect in the first place, but because the alternative is not that people aren't using AI at all, it's that they're going to be using it in a totally unmanaged way. So I think we've seen a little bit of the details now in terms of what's involved with beginning to adopt GenAI now. So there's the compliance side of things, and actually, Mike, you framed it as the confidence side of things. And then considering then the other side of that dilemma, so people that feel like it's important to be actually waiting for clarity before they begin adoption. Let's figure out what's concretely involved with that option. And I think one of the key points is going to be the updated regulations from the MHRA, and they've got updates to their regulations coming just late this year. So they have been taking a phased approach to this and making changes piece by piece. But yeah, as you mentioned, Mike, these are going to be changes to the medical devices regulation and how those apply to software. And the new requirements that they're introducing are going to be much stronger demands on healthcare specific GenAI providers. So in terms of a variety of things, there's technical documentation, there's the requirements on custom made devices. And again, as you were touching on, Mike, precisely where these are categorized and what category they fall into. And there is some risk, I don't want to overstate this, but I mean, it's actually a huge number of people producing these tools are small and micro, sort of a few experts and a small team around them. There is some risk that not all of the providers of these tools are going to be able to keep up. And actually for those providers, there might be some tools whose service is disrupted. They might have to remove themselves from market for a while. And so if you're worried about that potential risk, you might think that waiting removes the risk of wasted training if you are training people on a tool that has disruption, less risk of some interruption to the services. And then finally, and I think this final point is a little bit separate from the others on this screen, you might think that just by waiting longer and looking over the fence at what the other trusts and the other organizations are doing, you might think you can get a clearer picture of actually where you need AI in your organization and which use cases you want to be using it for. So zooming out again then, having seen the details of why you might want to adopt now or wait for clarity, it's clear that, waiting for clarity does avoid some potential of disruption maybe for some bespoke tools. But on the flip side, if you're waiting until late 26, early 27, that's sort of 6 to 12 months that could be spent building AI literacy in your organization, as Marcus was advocating earlier. And it's another 6 to 12 months where actually this shadow use of GenAI is going to be continuing unmanaged. So I'd love to get another temperature check from the room at this point. Now that you know a little bit more about what's involved with adopting, let's see how people are feeling about things. So we're going to put another poll out with a scale from 1 to 5. Number 1, you think it's actually best for your organization to begin adopting GenAI now. Number 5, you think your organization would be best served by waiting for clarity. We'll get some reasons from you just afterwards, but for now, where do you think your organization should be heading? Interesting. Okay, so we have exactly 2.5 out of 5. So that's directly in the middle. So it seems like the room is quite representative of this split that we've got. Mike, are you thinking of chipping something in?
Yeah, if you don't mind, Joby. It just occurs to me that I don't think a score in the middle necessarily means we've got a load of people at one end and a load of people at the other end. I think potentially it might mean that some people think that we should do both.
Yeah. So somewhere, so yeah. So, and then I think next we're going to get a little bit more information about that. We're going to put a word cloud out onto Team, and you can let us know what your reasons are for that in just a few words, whether that's, you know, a lack of governance, whether that's a lack of training, whether that's people in your organization are skeptical. Just in a few words, and give us some sense of what made you give the answer that you gave. We're seeing a lot of lacks. So a lack of expertise, a lack of governance, lack of training, but then also people saying it's great for time, we have a clear policy, it's the right tool for the job. So a real variety there. Okay, so let's open things up a little bit. I think that's a really good bit of fuel for the conversation. Yeah, so we've got a lot of different perspectives in the room. I think we'll hand off to our panel here. So we've seen what's involved with each option, some potential pros and cons of each. I guess I'll start by asking everybody, you know, what do you all think that are some wise choices that organizations should be making when it comes to GenAI and healthcare today? We've all touched on this a little bit, but maybe we can get a back and forth going.
I think just to finish the thought that I was expressing a second ago, I think there are cases for adopting now for certain tasks and certain tools and certain scenarios, and there are certainly cases for waiting for clarity. I don't think I would be investing in a bespoke AI tool that touched the patient record right now, because I think, you know, the financial risks of the company being affected by the regulations are significant enough on their own to make that a bad idea.
I'm curious, Marcus, you am I right in saying that at NHUC you have been adopting? You've got some ambient scribes going?
We've piloted, and we are looking to go into full implementation as well. I suppose on this, where you're looking at that scale, it's quite important to realise that humans and GenAI are living together. So they are going to be used. They are going to be key, I suppose, down the line. What Michael said, absolutely, it does depend on what AI tool you are looking to use. You know, is it going to have a direct impact on clinical input and on the patient's record? Is it going to be an administrative burden unload to help enable you to go through policies, documentations, that sort of thing? From my perspective, I don't think it can be as black and white. I think smartest choice right at this stage is to avoid treating any of these conversations as binary. It's not a case of let's do everything now or let's hold off everything until there's perfect clarity, because let's face it, I don't think that ever will be. Things will always consistently change. So because it's moving so quickly, that those extremes aren't sustainable. I think it's just about having the right balance with proportionate safeguards in place. It just takes having a common sense hat on when you are reviewing these things, and just making sure that you do things safely.
I'd be interested to dig a little deeper as well. Earlier, Kelly, you were talking about how, because you don't necessarily have a formal leadership role on these things, people are very candid with you about what they're using, how they're using it. I'd be interested to know, in cases where people are using these tools through a non-organizationally approved route, is your sense that that's usually because they're a bit frustrated with their organization and that they feel actually if they tried to get this done through the proper channels, it would never happen?
I think it might actually be naivety. And I think that maybe it's the medic mindset. It's a new shiny tool. It helps me. I'm going to run with this. It's going to save me time. But if the training isn't there, the policy isn't there, there isn't a conversation in the room around safety and regulation, I just don't think people have. I don't think there's malice there. I just think it's naivety. They're just running with it, just to try and make their lives easier. So that's probably more of where I've been seeing it. We've had an interesting experience where, because we're in urgent care, we've got a lot of the workforce who work elsewhere, where they are in organisations where they are allowed to use Heidi, for instance, or another piece of AI, and then they're using it within our organisation. So for us, it's been about being really clear and transparent and open and honest about our policy. And I think the other thing that really has helped me and other clinicians is examples of where we could use it, where we can't use it, and also naming the different types of AI, because we're not experts. We're trying to get through patients, and so when you hear these terms like by your own or consumer or even Gen AI, maybe we don't even understand what these terms necessarily mean. So just breaking it down into simple, transparent communications has been key for us.
Sure. Yeah, no, that sounds really important. And yeah, I'd be interested, you're nodding along, Mike. I'd be interested to know, in your experience of the skills people need, do you actually feel like that's a helpful way, sort of helpful first steps, is just to include people in conversations about what is this tool? What is this tool not? What are the rules,
Yeah, I always come back to some mandatory training that we have in the trust, and I don't know whether it's UK wide or whether it's Leeds specific, but it's always a story about Steve who goes home on the bus and leaves some paperwork or his laptop on the bus, and how that's an information governance risk, and all that kind of stuff. And you do it every year, and it's always the same story, and it's always Steve, and that somehow sticks in your mind. Even though it's tedious and irritating to have to do it every year, there is something about it. And I think if we can start to describe some of these cases of, how we use our data, how AI can be used, beneficially and safely, but also in a risky way, if we can make these kind of stories out of it, that's the kind of thing that will stick in people's minds. I'm not suggesting we necessarily do mandatory training on this, but I think the story element of it is quite memorable. And sticks with people. That's certainly an effective way that I've seen of giving people a sense of what the limits and restrictions are. The other thing that I find is people just have absolutely no idea where the data's going. They don't realize that typing something into ChatGPT means that it's going to OpenAI and that they're consuming it and they're using it for training their new models, and it's going to be embedded in AI for forever to come. And people also don't realize how little data can be identifiable, and how just taking the patient name off doesn't necessarily make it de-identified. So I think educating people in all that nuance is complicated, but educating people that there are issues here and that they need to think carefully and ask the question, and delineating the cases in which they can be confident again that they're okay, and the cases in which they feel in their gut, well, maybe this isn't quite right. And then, to have some guidance and some policies that they can look at and say, yeah, actually, no, I shouldn't be doing that. Or, yes, I can do that, but I need to do it in this way. I need to remove that information, whatever. So, sorry, long-winded answer.
No, that's good. It's sounding like it's just conversations about the basics and actually not assuming that people understand what an AI tool is. And like you say, where the data goes, and the fact that if you're on a free plan, you are the product and your data is being used to train the model.
As someone who used to work for HEE, I can say with certainty that it's education, education, and education.
Yeah, so important. No, that's really helpful to hear. Thank you, everybody. And I think in that case, I think the next slide is going to be a little bit less surprising than perhaps it's planned to be, because this is where more or less where people have been nudging things. You don't have to stick to one side or the other of the dilemma. So, of course, it's going to be up to each organization to choose something that works for you. But, we want to leave the session with some concrete takeaways. As Marcus was alluding to earlier, it's very possible to, embrace the adoption of consumer tools that people are already using today, the ChatGPTs of the world, and then wait until a little bit the regulatory dust has settled, as Mike was saying, before adopting a bespoke tool and being sure that that market is a little bit more stable. And if that is a strategy that works for your organization, then, words on the board are adopt consumer GenAI now. it's a little bit more like turning the existing shadow use into safe use, because the idea is that the consumer Gen AI is there anyway, right? And this is just introducing the right policies, the training for people, addressing that shadow use. And then on the flip side of things, I think just by nature of bespoke Gen AI tools, whether that's an ambient scribe, whether that's automating the discharge notes for a patient, just by nature of being bespoke, they sort of demand a little bit more from you in knowing what task you need it for and where you need help with AI. And so this is one potential middle ground that you can go with if you're looking for a sort of practical takeaway. And as it's been mentioned, probably safest just to be using consumer Gen AI for admin tasks so that you're not falling afoul of the medical devices regulation. And again, if this is a sort of method that does suit your organization, it does have real benefits. So you get, as Marcus was alluding to at the start, some real practice, both for the people using the tools, at using them safely, but also for people in leadership roles at regulating them safely and having the proper controls in place and applying them. Obviously, point number 3, you get the goodies of AI. This is why people are excited about it in the first place. You get to enjoy those time-saving benefits. And then finally, I think the more that people are using these AI tools, you might find actually that you get a much clearer sense of, even if you're just using them for admin tasks to begin with, actually use cases A and B, AI is really helping us with that, and we'd like to go further down that route, but use cases C and D, maybe there was a lot of hype around them, but we're finding actually in reality, AI isn't appropriate for us there. And so you're more informed when it comes time to actually procure these bespoke tools and acquire them. So what have we learned then? I think it's become really clear that the choice to just not adopt anything is a bit of a red herring. It's really, you're accepting that shadow use is going to continue in that case. Of course, that, the basic safety skills are really important, and that actually, if you want to build those with people using consumer tools for admin tasks, that can be an achievable first step. And then also that making sure, you've got compliance with GDPR, you're completing data protection impact assessments, and making sure that you have a clear policy in place, as Marcus was mentioning, are really important parts of the governance process. Of course, one way, when it comes to us at Skills to Health, one way that we'll be able to help is with the training side of things. So we've been developing an e-learning module pretty much when we heard about the issue of shadow use. That was sort of the motivation and how badly training is needed just for the real basics of safety. And so this is the e-learning module we've made. It's not got the intention of trying to turn anybody into an AI expert. It's actually just about giving sort of the basic skills to keep your use of these tools legal, to keep the use of these tools safe. And we've included in this e-learning module some sort of simulations of AI tools, so you can actually practice, chatting to a chatbot, being careful about what information you're putting in, as Mike was alluding to, making sure that the data you put in is thoroughly anonymized, not just removing a name, and then also spotting the risks of the output it produces and making sure you're checking for the right things. So everyone will be sort of sent a follow-up email after the webinar where they can have a link to check this out. And if you're an organization watching this and you're in need of something, but it's not quite this, then I would encourage you to get in touch. We offer bespoke solutions as well that can be both digital and blended. But in terms of, that's how we can help in terms of training. But I think I'd love to get some perspectives from everybody in the room now. I know everyone's going to be coming from their own perspective, different roles and organizations. So at this point, do submit some questions into Teams, and we'll do our best, whether that's directed at our panelists or myself, we'll do our best to answer them and hopefully give you some sort of practical takeaways as well, because those have very much been missing in the discussion so far.
I've seen the first question from Dominic, I think it is. about what AI, particularly Gen AI, does when there's a lack of information or a lack of data. I think this is fascinating because I think this is one of the biggest challenges of using AI, this type of AI in healthcare, is that it's very confident. It blusters into what I call gaps. So if you give it some information and then ask it a question that requires other information, it won't necessarily tell you that that information is missing. It will just fill in the gaps with something plausible. And that can go as far as making up details about individual patients if it's used in that scenario. It's effectively hallucination, but what's being noticed is that when you give it partial information, it tends to hallucinate more into the gaps. And where you give it the information, it tends to remain more grounded. That's only a tendency. I think in terms of dealing with that, partly it's checking the outputs, but partly it's just educating people about the tendency of AI to do this. And once you kind of get your head around it, you can see it. You can see the type of language that it uses when it's kind of fluffing and it doesn't really know what it's talking about. But it can be subtle to the untrained eye.
Yeah, definitely. And I can speak as well from a training perspective at Skills for Health, although not healthcare specific. 2 lines can actually really help you there. If you just write your request to Copilot and then add at the end of it, use direct quotes to support each of your conclusions, and then just beneath that, flag when you're unsure. And there's always risk of hallucination. That doesn't eliminate it, but that really, really holds its feet to the fire in the sense that every answer it gives you, you can see what it's going on, and it becomes blatantly obvious when it's going on nothing. And actually just telling it to flag when you're unsure, you'll get a huge number of answers that it says, well, actually, I don't know the answer to that, but I can help you in these few ways, which of course is much less dangerous. We've got a question about how secure is a private Copilot provided by the company. I'm using it to enhance my reasoning, not to give me the formulation. I'm guessing formulation is referring to sort of clinical decisions. Feel free to clarify, Dominique, if not. I mean, Marcus, so you guys have been using Copilot at NHUC, is that right? Maybe you can speak to the privacy of this.
Yes, absolutely. So we've had to vet quite a few generative AI tools, and a point that Michael raised earlier as well. Do you know where your data is actually transmitting? It's something I alluded to earlier. Is there international data transfer? Using ChatGPT, for example, we said no straight away. The data risk is far too high. It's international data transfer. You're no longer being protected or governed by UK GDPR or even EU data transfer. It certainly doesn't meet the USA, UK data transfer provisions either. One thing that we have got is Copilot. It mysteriously appeared on everyone's computer simultaneously. We have had NHS Connect, which is the former NHS Mail, sending out emails to everybody saying Copilot is now an approved and authorized tool for use. Have fun. Most people didn't read the little bit at the bottom which said please do not put in anything sensitive commercially or otherwise. But so it was almost like a blanket, go forth and have fun with this. Now, Copilot itself is a far more secure tool than ChatGPT or any other sort of widespread consumer generative AI tools. Insofar as the data that you put in is and what comes out of it at the other end, it does remain within your tenant. So there are certain controls in terms of the data transfer. What you're putting in doesn't necessarily go out into the stratosphere and the World Wide Web. But that said, there are still standards that you have got to meet. So you do not want to be inputting any personal identifiable data. You don't want to put anything commercially in there as well. Also be mindful, just going back to the previous question about how can you be sure about the answers coming back, it's all about the prompts that you put into the tool. If you're leaving gaps in your prompt or you're very, very high level, then you're going to get a high level output. So you only get out of it what you put in. What you do put in as well, be really, really careful. So a lot of people don't realize this, but if you are running an Excel spreadsheet and you've got copious amounts of back-end data and it contains private data, for example, you upload the chart that's the output from that Excel spreadsheet into Copilot, you're ineffectively giving Copilot all the background data because it can extrapolate that. If you change it into a picture or an image, for example, you eradicate that scene because you're effectively sending what is pixels, and pixels don't carry data. So long story short, Copilot, we've reviewed very, very carefully. We are probably going to look to adopt Copilot Pro just because there are a few other benefits, certainly in form of bots, but we are doing all of this with our IT consultancy support to make sure that we are not opening up any gaps for risk. But Copilot itself, short story, it's the data stays within your SharePoint.
And we've got, I think, a really important, thank you, Marcus. Yeah, no, that's really, really helpful to hear. I've just spotted a really important question from Jenny, actually, basically pushing us to actually be a bit more specific about why use AI. I think that's totally fair enough. We've maybe assumed that people are sort of on board with that. But yeah, can we be a bit more specific about why it's worth using these tools in the first place, especially given their environmental and social consequences? I mean, it strikes me that, Kelly, you were reeling off a very long list of conversations you've had and things you've heard about why people are using these tools. Would you be able to speak a little bit to that?
Yeah, I think for me personally, as I said, I'm using it more as a thinking partner. And for me, I am always asking myself, where's the power balance here with this relationship? Because it's a relationship with a tool. And if I don't want to be someone that's passively receiving the output, I don't want to just take it for granted that what it's saying is correct. So for me, like I've been using it recently, I'm trying to have a think about how I'm going to approach the effective domain in the CQC and all the quality statements and what evidence I might use in our particular working environment. So I've been having, putting in things like what would, CQC effective statements, list them. Okay, I'm in urgent care. What sort of things would you suggest? And then I am reading that and then having a little think, could I do that? How would I use that? So for me, it's really about the power balance, bringing that human into the loop. It's my responsibility to interpret, to then go and check it against the CQC guidelines. So I'm not just using that as like some superior intelligence, better than me, if that makes sense. That's how I've been using it. And yeah, it's been really helpful, actually.
That's great to hear. Mike?
Yeah, I think it's a really interesting question, Jenny, and particularly the environmental side of it, and maybe even the ethical side of it from the point of view of all of the impacts on people that it has globally. My personal view is that use in a healthcare scenario is likely to be far more ethical and beneficial than 99% of the other uses that these tools are being put to at the moment, sort of out there on the internet. Having said that, I think it is important to think about the impact we're having, and I think this will come back to bite us because at the moment most of these big models are being heavily subsidized by venture capital, and that's going to stop at some point, and the costs of using these tools are going to go up at some point, and they may become more efficient, which may reduce those costs again. I think there'll be a big pressure for that to happen, but we're not there yet. So I think we might start to see the costs in terms of the price, and the cost of the energy and the costs of all of the other things reflected in that. So I think the way we're using GenAI at the moment might be a little bit of a kind of a honeymoon period, if you see what I mean.
Yeah, no, that's very true. And the costs are rising. It's been seen in some tools. I'm just conscious of time and I don't want to keep people past their commitments. So I think we'll move on at this point. Questions that we haven't had a chance to answer, we'll include in a follow-up email and we'll give some answers there because there are some really good ones worth engaging with. But I just wanted to leave everybody before they go with some, again, hopefully keep things practical, some resources that they can go away with. And I'm looking especially at the one on the far left. So this is an AI policy that was actually published by the Somerset Foundation Trust. And they've actually said on their LinkedIn, feel free to use this. Just adapt it, modify it. Please credit us, of course, attribute it to them. But I'm sure this is going to be a godsend for lots of trusts, especially ones that are feeling that actually they don't know where to start or they can't find the time in the day to build something from scratch. This is a ready-made example of policy that people are actually using in practice. In the middle, the report that myself and Kelly have been referencing throughout the webinar, very interesting. Even if you don't have the time to read it, I really recommend you just have a skim. Over 1,000 GPs took part in it, and it's a very sort of unfiltered look at how these tools are being used. Finally, on the right, quite a thought-provoking article, basically arguing that decision-making support is where it's at, and that's the future that we should look forward to. Not an opinion that everybody holds, and slightly controversial in some ways, but the author, Luke Allen, is very much knowledgeable in this. So all of those will be provided in the follow-up email. And at this point, I'd just like to thank a massive thank you to all of our expert panelists for joining us and giving up their time to try and make this sort of thorny issue a little bit more manageable for everybody. And a massive thank you to everybody that's attended the webinar as well. And good luck. You know, hopefully this has made things a little bit more practical, a little bit more manageable for you. It's been a pleasure to have everybody.
Thanks, Jeremy.
Seeing a hand from Helen. Helen, if you want to submit whatever it is as a question in the Q&A, then we'll be able to sort of respond to that in a follow-up email. And it can be one-to-one if that's needed.